Most people really hard to accept changes that suddenly appears in their life, because people tend to stay in comfort than to take the risk to move forward. We are fear and so afraid to accept adjustments, and sometimes people need a lot of time like weeks or months to accept and to adjust about these changes. That is why nurses are challenged to take care of these people who have impaired adjustments. It is really challenging on how a person will trust you and trust your interventions, especially if these people are not looking for a change or to modify their life. That is why the nurse must explain to the patient that these changes will result in a more favorable outcome and will not create more problems. This is a nursing care plan sample about impaired adjustment of Mr. Dutrio, 78 years old. The patient is diagnosed with type 2 diabetes and the doctors imply to make adjustments in his nutritional diet, leading to reduce his intake of foods with high carbohydrates and stopping him to drink alcohol. The patient is rejecting those changes and denies of having type 2 diabetes. If the patient do not make adjustments, this could lead to complications like blindness and amputation. Assessment. Subjective, the patient verbally denies his health status. Objective. The patient rejects medical treatment, leading to a failure to take actions that would prevent further health problems. Their patient refuses to communicate with the nurse and rejects nursing intervention. The patient still eats food and drink beverages that could lead to life-threatening condition. The patient acts energetic to hide his health condition. Diagnosis. Impaired adjustments related to failure to take actions that would prevent further health problems. Planning. After 2 hours of nursing intervention, the patient will demonstrate increasing interest and participation in self-care. The patient will also develop ability to assume responsibility for personal needs when possible. The patient will also initiate lifestyle changes that will permit adaptation to current life situations. In addition, the patient will identify stress situations leading to impaired adjustment and specific actions for dealing with them and identify and use appropriate support systems. Interventions. Assess the degree of impaired function. Is it life-threatening? Do the patient, Mr. Dutrio, need an immediate care? A physical and psychosocial assessment must be performed to determine the extent of the limitations in the condition of Mr. Dutrio. Consider the limitations of person having type 2 diabetes. Adapt to the situation by listening to the patient's perception of inability. Identify helpful resources of Mr. Dutrio's past and present significant support systems such as family, relatives, church, groups, and organizations. Is the patient signifying impaired adjustments by expressing emotions such as overwhelming anxiety, fear, anger, active or passive denial? There are a lot of contributing factors related to impaired adjustments. Identify one or more contributing factors in Mr. Dutrio's case by listening to his perception of the factors leading to the present impairment, noting onset, duration, presence/absence of physical complaints, social withdrawal. Review his previous life situations and role changes with patient to determine coping skills used. Determine lack of inability to use available resources. You must also review available documentation and resources to determine actual life experiences, resources like medical records, statements by parents, relatives, friends and coworkers, because in situations of a great stress, physical or emotional, the patient may not accurately assess occurrences leading to present situation. Organize a team conference with the patient and ancillary services to focus on contributing factors of impaired adjustments to deal with the impairment and plan for management of the situation. Tell the patient that he is doing a great job, and this acknowledgement about his efforts to adjust lessen his feelings of blame, guilt, and defensive response. Share information with the patient's peers when illness/injury affects body image, because peers can support for this situation. Mr. Dutrio must understand the disease process, causative factors, and prognosis. Let the patient ask questions to improve understanding about the nursing care. Provide an open environment encouraging communication so that expression of feelings concerning impaired function can be dealt with realistically. Use therapeutic communication skills such as active listening, acknowledgement, silence, and I statements. Evaluation. After 2 hours of nursing intervention, the patient demonstrated increasing interest and participation in self-care. The patient also developed ability to assume responsibility for personal needs when possible. The patient also initiated lifestyle changes that will permit adaptation to current life situations. In addition, the patient identified the stress situations leading to impaired adjustment and specific actions for dealing with them and identify and use appropriate support systems. If you like for more nursing care plan related to impaired adjustments, you just need to subscribe to our YouTube channel NCP Mania. We have tons of nursing care plans available to watch and to learn.